Atrial fibrillation, or AF, is the most common rhythm disorder that we see in our clinical practice. In this, the upper chambers of the heart, that is atrium, beat in a rapid and irregular manner. It actually leads to an ineffective contraction of the atrium, leading on to stagnation of blood in the atrium and sometimes even clot formation. The morbidity of atrial fibrillation comes from the repeated hospitalization for palpitations. Also, the clots which form inside the heart can go to brain and cause massive strokes, and they also put patient at risk of repeated hospitalization with heart failure. So, it is not only a rhythm problem, but it impacts the patient's quality of life significantly by putting up at risk of heart failure as well as stroke. For many years it was treated with medicines, but medicines have less effect in this rhythm problem. It needs ablative therapies in which the 4 pulmonary veins which drain blood to the heart are isolated. It was done first with thermal energy using RF and later on with cold therapies using cryoablation. But both these thermal sources used to cause collateral damage by affecting the organs or structures around the heart. Pulsed field ablation has been a major breakthrough in the management of atrial fibrillation. In this, we use very high voltage electrical impulses for very short duration, leading on to damage of only the selective abnormal myocardial substrate responsible for atrial fibrillation. Since it is very specific for the heart muscle cell, which is pathological, it makes the procedure extremely safe and reduces collateral damage by sparing the organs surrounding the heart. It is not only safe, it is equally effective as any of the early ablative solutions, and the procedure is very quick because it requires very few seconds of electrical impulse to damage the abnormal myocardial substrate. So, pulsed field ablation has been a paradigm shift in the management of atrial fibrillation. It has gained acceptance widely in the international arena, and for us it is going to be the gold standard for maintaining our atrial fibrillation patients in sinus rhythm in the coming times.